My name is Beth Privitera. I am a principal at HS Design in New Jersey, and I'm also associate professor at University of Cincinnati in biomedical engineering. And I came out here to participate in the Industrial Designers Society of America Medical Design Conference in a panel session today and tomorrow. Super excited to be here. What do I think about the intersection between design and healthcare? Well, I've been interested in both of them throughout my entire career. So I've spent the past 25 years doing both of them. I started off as a designer working for a Johnson & Johnson company, and then actually transitioned into an academic appointment, spent a few years as a member of a clinical faculty where I'm a designer in a clinical faculty of emergency medicine, working directly with the hospital. And so it's a natural evolution. There's a lot of similarities between designers and physicians and clinicians. We like crazy hours, we like to work hard, we like to problem solve. The biggest difference though is that where designers like risk, physicians and nurses don't like risk. And so that's fundamentally the biggest difference. But it's a natural collision, and never more important than today with our healthcare crisis and our situation that's going on. Well, volume to value, that says that we're taking from something that is over and over again large and cumbersome, and really driving down as to the value and getting down to the individual. So breaking it up, so from something that was really, really big into something that is definitely personalized and individualized, because no one wants to be a number, and you never want to be a number when it comes to your own personal health. And really, when we come to think about volume, I think it's about what value is important to whom and for what purpose, because I don't think that value is the same depending upon who you are, where you are in your life, whether or not you're a physician, you're a nurse, you're a patient, you're a caregiver, it's your child, it's your husband, your grandmother that's having that situation. Your value proposition is different, and we can't assume that it's the same. So we can't take healthcare and our health situation and go from these very large volume hospitals that are impersonal and expect to have a level of relationship and care that we need when it comes to our own health and being better. People walking out of the door today, I think they really need to take away that the collaborative doors are opening, and that, yeah, it's super hard to, as a designer, to access care, to access and get in, to do our jobs, to understand what they go through in their day-to-day life. But that's changing, and it has to change, because we can't go on and assume that it's going to stay the same. Change is constant, so we need to collaborate, we need to address, and we need to find the ways to collaborate. So if that means that we need additional training, or physicians and nurses need additional training, we need to help them understand what we need, and they need to help us understand what they need in order to come up with the ultimate device designs, the ultimate system designs to improve our healthcare.